Hello, I'm Ken Cutbush. I'm an orthopedic shoulder surgeon working in Brisbane. I'd like to share with you a case of one of my patients. This is a 35-year-old man. He's had instability in his shoulder for a long time. He was 19 when he first dislocated his shoulder. He was boxing with his brother, he was mucking around, and the shoulder came out. Since then, he's had 30, maybe 40 dislocations. He's been trying to put off surgery as long as possible. It's got to the point now the shoulder is so unstable, he's really not coping with it, and we're starting to talk about surgery for his shoulder. I'd like to share his scans with you. This is his MRI scan. It's a cross-section through the shoulder. This is the back of the shoulder, this is the front. You can see his lungs here. This is a rib. Shoulder blade is here. And this is the labrum at the back of the shoulder, that little triangle there. So the black line is bone, then there's a layer of cartilage. The white is fluid, and then you've got another layer of cartilage, and then the bone of the humeral head. That triangle at the back of the shoulder is his posterior labrum. It's fiber cartilage. It comes up black on the scan. And at the front of the shoulder, that's his anterior labrum. If we take the scan down, there is a tear through here, just a faint white line there which you're not seeing at the back. That's normal at the back, and that should be mirrored to the front, whereas this labrum is a bit edematous, and there's that labral tear down through there at the front of the shoulder. What's more, I'll show this to you. At the back of the shoulder, there's a little dent in the back of the humeral head. See the white there? There's a bit of fluid sitting in the bone there underneath the tendon. Well, that's called a Hill-Sachs lesion, and that's from the shoulder dislocating out the front and then hitting back against this corner of the socket, just there. So that piece of bone there, that point of bone, has dented the back of the humeral head and caused that indentation in it. So he's got an unstable shoulder, he's got a labral tear at the front, he's got the Hill-Sachs lesion at the back of the shoulder, and he's been having recurrent dislocations. We're now going to share with you the CT scan. The CT scan is very helpful in deciding what surgery to do. We know that the shoulder is unstable, and we know that he needs surgery because it's dislocating so many times, and it's got to the point it's not something he can cope with. This is the CT scan. We can spin it around. You can see this is a 3D reconstruction of his shoulder blade. We've taken that from axial slices like that MRI scan. And then the humeral head has been electronically subtracted away so that we can see the socket. And the thing about this is it should be pear-shaped. He would have had bone here at the front of the shoulder. He's had several dislocations chipping off the bone at the front of the shoulder from the socket. And so we've now got a socket that's about as wide at the bottom as it is at the top, whereas the normal situation is pear-shaped and much wider at the bottom and at the top. So in him, he's very active, he's doing contact sports, and what we're going to do is an arthroscopic lateral and labral repair. Now the lateral procedure is where we take this piece of bone here, cut at the base, split the muscle at the front of the shoulder, the subscapularis, and place the bone at the front of the shoulder there. I then secure that with 2 screws and then repair the labrum over the top. It's possible to do that as an open procedure or an arthroscopic procedure. I personally prefer the arthroscopic procedure, and that's what we'll be talking about doing for him. It's a very successful procedure. It is a significant procedure, and we need to talk about potential risks and so on. There's a risk of nerve injury with this operation that runs about 1 in 100, 1 to 200, and there's risk of the bone uniting to the glenoid. The bone that we transfer down to the front of the socket there and the socket, 2 bones have to join together, which is very important for people to know that they've got to look after the shoulder for the first 6 weeks post-op. So that's a very interesting case of a patient with an unstable shoulder where it's dislocating out the front. Thank you for listening.